Hi everyone. So my name is Brendan Harney. I'm originally from Melbourne in Australia. I did my PhD at the Burnett Institute and Monash University. I'm currently a postdoc in Montreal, in Canada, at the University of Montreal. I'm also the vice chair of the INSU EMCR Early Mid-Career Researcher Special Interest Group. So for the last few years, INSU have been kind enough to offer us the opportunity as the EMCR group to essentially have a workshop / presentation session / symposium on essentially whatever we want. They kind of have to approve it, but we tell them what we want to do. So after some meetings and discussions, a group of us thought that something that doesn't really come up or we don't get a lot of exposure to as early and mid-career researchers is knowledge translation and research dissemination. Academic publications, presentations at conferences are kind of the key outputs, but clearly we all know it's very important to disseminate our research to broader groups, the community, policymakers, the people we do the research on. And I do completely get the irony of having this at an academic conference. But we have a great panel here that have various experiences in their academic journey and their knowledge translation and research dissemination. So without further ado, I'm going to invite Tyler Bartholomew, who is an assistant professor in the Division of Health Services Research and Policy at the University of Miami Miller School of Medicine. Tyler's research focuses on developing, testing, and scaling up evidence-based harm reduction interventions for people who use drugs. And Tyler's going to give us firstly an overview of research dissemination more broadly, but then talk specifically about some of his work around disseminating their research from Florida's Needle and Exchange program to the policymakers in Florida. Thank you, Tyler.
Do we have a clicker? Clicker.
Did someone take the clicker with them from the last session? Please tell me not. Oh, it's down there on the table.
Okay, perfect. Thank you for that introduction. And my clock has already started, so I'm going to get started. Today I'm going to talk, the presentation split into kind of two sections. And really the first part of the presentation, I really want to highlight rethinking research dissemination. And so I'm going to just provide an overview of non-traditional research dissemination activities. This is something that I think is really important for early and mid-career investigators. So I'm really excited to talk about that today. I also want to highlight I am a research affiliate for CHERISH, which is the Center for Health Economics of Treatment Interventions for Substance Use Disorder, HCV, and HIV. And they have an amazing dissemination and policy core that really targets this knowledge translation that I'll talk about today. Perfect. So just a quick overview of today's presentation. We're going to define what dissemination is and how we can actually use it in our research. We will talk through what are our traditional methods for dissemination of our research findings. I'll briefly talk about the examples of non-traditional methods of dissemination. And then I'm going to provide an example of what we've done in the state of Florida, which talking about in the international context is really interesting. Probably one of the most conservative places in the entire United States. People probably view the entire United States as conservative when it comes to international drug policy. But really, this was a monumental moment for the US and the Southeast, bringing harm reduction to our state. So what is dissemination? So it's really important for us to define what dissemination is. So dissemination are active approaches of spreading information, and in this case, we're really focused on research findings, to the audiences, they may differ, or interested groups via determined channels using planned strategies, right? So this is a very active process. This is not, I view this on kind of the sister to implementation science. Then there's the diffusion of innovations as well that we can think about. And dissemination is more active than diffusion. And oftentimes when we publish our research, we think it's going to diffuse through different audiences and groups and be used and implemented properly. But we also know that that's not true. So that's why implementation science exists and dissemination science exists. So there's an entire study or field out there of how best to communicate and distribute research findings, evidence-based practices or evidence-based interventions, and innovations to specific target audiences in ways that ensure the information is understood, that it's adopted, that it's integrated within their systems, and that it's used effectively. And so it really focuses on developing strategies, methods, and frameworks that facilitate the widespread sharing of scientific knowledge to practitioners, to policymakers, and the general public. And one of the cornerstone pieces of dissemination science is this also integration with other fields, right? I think this is also true for implementation science, but political science, we can pull from that. Health communications is really important when we think about dissemination science. So the intersection and interdisciplinary work that presents itself with dissemination science is really important. So traditional dissemination, what do we actually do? I think Brendan highlighted this really well, is really the two pieces of dissemination activities that researchers focus their time and energy on are peer-reviewed journal articles and conference presentations. This is how we disseminate our research findings. Oftentimes, I feel like I'm just talking to a crowded audience that knows the results of what it's going to look like and agrees with these results that I'm presenting. And so it feels like an echo chamber sometimes when you're presenting to other colleagues, other academics in this space. And so traditional research dissemination is well established, it's conventional, it's tied to academic promotion as well. So it's really important for us to highlight the academic systems that we work in as early career investigators of when it comes to citations, number of oral presentations that you give, is really important for promotion and tenure within our university system. But again, this is generally geared towards scholarly and expert audiences that we think about how we're disseminating our work. Perfect. So why do we need other methods of research dissemination? One, I think it's really important to think through is broader reach and accessibility of our research. So we know that traditional research has paywalls, limiting our access to research findings, especially in the community. I don't know how many times a community partner would send me an article and say, can you give this to me? Can you go behind your paywall and get this for free and get the PDF and send it to me? So we know that our research is really inaccessible for community members to access. And we also know that traditional methods are geared towards academic audiences and not necessarily public or community partners or policymakers in that case. We also know that there's a need for faster dissemination. Peer-reviewed process takes months or even years. I think everyone here has struggled through the peer review process of getting their findings out into the literature. And we need to make sure our findings remain relevant and timely for policy and communities. Oftentimes we might publish something, it's a year after a timely incident has occurred in our communities, and so the relevance begins to wane over time when we think about the traditional dissemination process. We also want to improve engagement, so developing interactive platforms like webinars, social media, which we'll talk a little bit about, and websites allows for greater engagement with other audiences outside of the academic space, which is really important. We also want to harness reaching underrepresented groups in this circumstance. So we need more equitable knowledge sharing and inclusive methods for audiences of different social status. We also want to enhance the impact of our research. I think everyone gets into research because they think their research is going to make an impact on today's world, society, on policies, on programs, on procedures. I know that's why I got involved in research. But oftentimes, much of our research has real-world implications, but our traditional methods of how we disseminate that research do not reach people who can actually apply these methods or apply their research in their settings. We also want to encourage collaborative research. I think NSHU and others here that work in this space are really good at doing collaborative research, so maybe this is not something that applies to the NSHU audience. But I do think things like open science, where we publish our methods, we publish the data, we publish the code that we use, we publish all of the aspects of the research process, and crowdsourcing ideas allows for community members to actually get involved in the research process, and that hopefully leads to faster implementation in the real world. And then finally, I think this is a really important aspect, especially in today's society, is increasing public trust in science. So we must do a better job as a research community when it comes to building trust in our research to ensure that public understanding is there and we address misinformation in real time. I think probably the cornerstone example that everyone sees is COVID vaccinations. This is really true and held strong in the US. There was a recent survey that was sent out that only 28% of people are going to get the updated COVID-19 vaccine. And so, but the evidence base behind the COVID vaccine is profound and really a scientific miracle when we think about how fast we were able to develop that vaccine and get it implemented. So it's really a dissemination issue and an implementation issue when it comes to that vaccine. So what are the different types of methods that we can think about using? This is meant to just kind of give us a broad stroke overview of the different methods that I think are important for us to think through. Data visualization, I see this often when we think about modeling, statistical models, putting it out on websites, allowing it to be gamified so an end user can come into that website and see if I scaled my intervention to this percentage, what am I going to see in a reduction in the epidemic? So gamifying some of our modeling can actually be a really important dissemination technique, especially for those who engage in mathematical modeling. Social media. Everybody is on social media. Social media is a powerhouse for dissemination, for media dissemination, for communication. So Twitter or X, Instagram stories, TikTok, these are all great platforms that we should all be engaged in as researchers. And there's more and more evidence that are coming out when it comes to professors or researchers who are actually on Twitter in the academic space as well. So tweeted articles actually receive more citations than non-tweeted articles. So thinking about the different journals that we apply to, different journals are on Twitter. When they're tweeting out that research, you're actually more likely to get cited in the future. And so, being a researcher, thinking about the academic system that we work in, if you're not on Twitter, you're kind of a leg behind now when it comes to the dissemination of your research findings and having your work cited moving forward. We can also think about podcasts and webinars. I think podcasts is a great way to disseminate research or new topics in a field. Community engagement, such as forums or public lectures. We can think about town halls that you can hold in your community to disseminate your findings. One that I have not engaged in is creative art. So thinking about art installations to, express the research findings in a different way. It's a really intriguing way of disseminating. I think it's a really interesting idea of doing creative art. Newsletters, we always have those listservs and email blasts that get sent out, or research blogs. And then we have op-eds and news outlets. I think writing op-eds is a technique that you learn how to do, just like writing a social media post or how you actually present your research on Twitter. There's a whole method behind the madness that we're not going to get into today because I'm out of time. But if you're interested in more resources in this space, as I mentioned, Cherish has this great policy core. They have a free online course on key tools and skills in translation and dissemination for researchers. So you can learn some techniques on writing op-eds or how to publish on Twitter. That's the link up there in the QR code, thinking about how I disseminate this information to you. You can scan the QR code and it'll bring you right to the website to take a look at. And if you're interested more in Cherish, you can scan that QR code. But also there's this great paper on 10 simple rules for innovative dissemination of research that you can scan that QR code to pull up, so you can read through the different techniques that can be used, or you can start thinking about how can I better disseminate my research. There we go, perfect. So the example dissemination project that I'm going to talk about today is the work that we've been doing over the last 10 years in the state of Florida, bringing the first legal syringe services program to our state. Other international countries are probably like, we've had needle exchange for a long time. The US South has been desperate to have harm reduction services for a very, very long time. And on the back of people's moral hazard, racism, structural racism, we know that these programs have really not been implemented to scale in the US South. So it's really important for us to engage in the political process and the policy process to get policymakers on board with implementing these programs. So we published a paper in Academic Medicine highlighting the University of Miami's IDEA Syringe Services Program, which was the first sanctioned legal syringe services program implemented in December of 2016 at the University of Miami. And so what really sparked this entire movement to bring harm reduction to Florida was research. And so there was a study published in 2012 in Drug and Alcohol Dependence that showed that the number of improperly discarded syringes on the streets of Miami was 8 times higher than San Francisco. San Francisco has had needle exchange for a very long time. At that point, there was no needle exchange in Miami. And that publication, while it was disseminated through traditional methods, ended up as an op-ed piece in the Miami Herald and gained a lot of attention from the public, from policymakers, thinking about Miami, number one in new HIV infections. We don't have this tool implemented in our context to facilitate HIV prevention. And so it sparked this entire movement, especially from the medical community. The Florida Medical Association adopted a resolution to actually bring syringe services to our state. And so a bill was filed in 2013 that would actually authorize syringe exchange across the entire state of Florida. It took many years after that. That bill failed immediately. It got known as the needle bill. So there's a lot of stigma related to what was being talked about. Everyone was against it. The health department was against it. The policymakers were against it. The Sheriff's Association was against it. Every single institution that makes a decision in the state of Florida was against it at that point in time. And that's why it took 10 years for us to get to where we got to. But on the back of the growing overdose epidemic that we saw in the US in the drug poisoning, we knew that this was an opportunity for us to move this legislation forward by aligning ourselves with prevention of overdose through naloxone distribution in syringe services programs. And so the second piece to this was information about economic burden or economic cost. I think these are really important narratives that get built off of the evidence around these programs. And we really wanted to disseminate that to policymakers. We know that policymakers are going to have different attitudes or beliefs towards a program or a policy or intervention. And so how we disseminated to the policymakers was really important for us to actually facilitate the behavior change, right? We needed them to change their behavior and adopt and support the policy if we were ever going to have a chance of getting this passed in our state. They scaled back the legislation and they passed in 2016 a pilot program. It's a 5-year pilot program, completely unfunded, one-for-one needle exchange. All of the pieces of the evidence were missing from a policy perspective, but we're able to implement the first syringe services program. And shortly after that, one of our first successes was the decrease in overdose deaths in Miami-Dade County, while all other counties across our state saw increases in overdose deaths. And so this was a prime opportunity for us, an open window from a policy perspective, to go back to the legislator and say, not only do we need to be doing this in Miami, we need to be doing this across our entire state. So at that point, it was 2018, 2019. We really dove into policy dissemination science at this point in time to say, how should we best be describing the needle exchange program? How should we best be describing or presenting the evidence on why we need to be doing this across our state? And so there was 2 really backbone theories or ideas as to which we presented or used when we designed our dissemination approach, which is audience segmentation theory and persuasive communication. So audience segmentation theory is recognizing that not everyone in a population is the same, which means a one-size-fits-all approach on how we communicate our evidence or our strategy is not going to be effective. Right? We know that there's different demographic reasons, behavioral reasons, psychosocial properties or traits such as attitudes, values, beliefs of our target audience, and the geographical context that is going to influence whether or not that person is going to agree or disagree with a certain evidence that you are presenting. In this case, we're really focused on the intervention of the syringe services program. This approach has been used in marketing and communication to tailor messaging and the strategies to be more effectively resonating with certain audiences, right? So we know that there's 2 different parties. We have Republicans and Democrats. We know that Republicans tend to be more fiscally conservative. Democrats tend to be more thinking about people and humanity and things like that. And so, going beyond just the party identification, we really dove into all of the policymakers at the state level to identify how they voted before on certain policies, what tweets they were making about certain policies or drugs in general, so that we can craft specific messages around what they wanted to know and what information they wanted to glean with the hope that it was going to drive adoption of the policy, right? We're hoping to change people's minds to actually allow this to happen. Then persuasive communication. So this is a process of using messages and strategies to influence, convince, or motivate an audience to change their beliefs, attitudes, and behavior. So you can see how these kind of go hand in hand. Persuasive communication is not something that I studied in school. I think we need a lot more persuasive communication studying in public health for researchers. But really the techniques that we use and think about are credibility of the message sender. So coming in as the University of Miami School of Medicine, we had a lot of credibility when it came to the support for why we needed a needle exchange program across our state. Emotional appeal, so evoking emotion to change thinking. So sometimes we see this as generating fear to cause people to change beliefs or behaviors that are going to lead into supporting or not supporting a policy. That is a technique that we see in politics day in and day out in the US. But sometimes the emotional aspect of it actually gets that policymaker to agree to a policy. And so having someone like a mom who lost a child to an overdose go into a policymaker's office and say, my son, my daughter might be alive today because of this program, it's really hard for a policymaker to then say, well, I don't agree with that. And so I think emotional appealing is really important. Logical appeal, again, this is, I think, where a lot of researchers put a lot of time and energy, is the data, the evidence, the statistics. Sometimes it doesn't matter what the evidence is, right? And in this specific lens, it's really important for us to get the policy through on the political process. And so we have the data, we have the evidence. If the policymaker wanted it, they could request it and we'll provide it to them. But this was not a central part of our dissemination strategy. We also had social proof at this time. We had the pilot program in Miami, so there was some type of proof of concept in our local context. We couldn't say, hey, California has done needle exchange for 30 years. They're gonna say, California is completely different. That is progressive. That is not how we do things in the state of Florida. So having the local data was really nice. And then scarcity, this urgency factor, right? Overdose is happening, scaling very quickly in our state. We also had high rates of HIV infection in our communities. And so presenting this as an urgent matter was really important for us to develop our strategy. I have 1 minute left. So just some successful dissemination strategies. We used localized data. We had student advocates go to the Capitol to actually disseminate this information. We tried to train them that if you were talking to someone who might be more conservative, might be a Republican, you maybe want to start with the economic argument first before you move into anything else. Now, if you're in a Democrat's office, maybe you talk about overdose prevention, HIV prevention. This is about human beings at this point in time. And so developing those tailored strategies and talking specifically to each of those policymakers through that tailored messaging actually made a really important and big impact. And we have this article from Ashcraft in 2020 in Implementation Science talking about policy dissemination strategies. And so we were able to leverage some of that information that was gleaned in that article. But this was handed out to all policymakers. What was really cool to see is that policymakers were using this on committee, so the policy process takes a little while to get through, but they were pulling that out and talking about it and advocating on their own when it came to the needle exchange program. We gained a lot of media recognition too. We were on NPR, the Associated Press, and all these highlighted, the public opinion or what we were gaining when it came to support for the program. This quote right here from one of our senators who voted no on the pilot bill. He said, I just want to say, when I started my career in the Senate, I voted against the pilot project, and I was wrong. The results speak for themselves, a very good public policy. And this showed us that we were changing people's perceptions who voted against it, who are now supporting it. This was us at 11:30 at night after they heard a 15-week abortion ban in the state of Florida, where we actually passed the Infectious Disease Elimination Act of 2019. This authorized all counties in the state of Florida to implement syringe services programs. We got it voted out unanimously from the Senate, 40-0. We had 2 no votes in the House, and Governor DeSantis signed the legislation in 2019. So we had a very effective strategy that actually promoted this policy to be adopted. We're doing this now on the local level. They made it an opt-in approach to counties, and so we're trying to now take the battle from Tallahassee to 67 counties across our state. And so far, we have implemented 8 syringe services programs since 2019. We currently work in about 40 counties where we're specifically taking these tailored messages and disseminating to our county commissioners. We're gonna make decisions. And we actually have a really cool project with the School of Communication at the University of Miami, where we're structuring, like I said, dissemination science, health communication, on how we actually best disseminate this information and whether or not it makes a difference on certain outcomes, right? We always want to evaluate our dissemination. Are we making a difference? Are we changing behaviors? Are people clicking on this? Are people learning things? And so we have this really cool dissemination project on tailored health communication that is going to be specifically for county commissioners in our state. Thank you for your time. I'm sorry I ran over.
All good.